Well, my practice is in Antwerp, in Belgium, and the focus in the practice is on implant dentistry and aesthetic dentistry. We are practicing in a multidisciplinary office together with 10 dentists and with 3 lab technicians. So it's a nice setup. It's not usual in Belgium, and I enjoy it very much. I think for me the major advances are first of all CAD/CAM technology, and especially CAD/CAM ceramic technology from the prosthetic point of view. I think from the surgical point of view it's all about being less and less invasive, and that's why again the guided surgery is really a big advance in today's implant dentistry. Well, I have implemented this technology in a few ways. First of all, the CAD/CAM technology allows me to have in a repetitive way nice looking restorations, and I think from the surgical point of view, with the guided surgery being less invasive, it's like more satisfactory and less traumatic for the patient, so it's an upgrade for our office. Well, I think it's only about indications. I don't see a lot of contraindications. The only contraindication I see is cases with very short clinical crowns, for example. But we were involved in a clinical observation study. It's not really a research project. It's about clinical observation. Until now, I didn't see any failures. So it's only about 1 year. I don't know on the long run, but time will show us what will happen with these new technologies and these new ways of taking care of our patients. Well, the precision is very, very high. It's in ranges that we are not always used to see when a technician has to manually manufacture the copings or manually manufacture the structures, the substructures. So that it's all about, in a repetitive way, have the perfect fit, in fact, on a daily basis, in a repetitive way. My most difficult implant challenge will probably be the patient with very thin soft tissue and the patient also with huge bone deficiencies. I think these are really challenging cases. The advances in implant dentistry probably for me will be at the level of the soft tissue, not really on osseointegration. I think the surfaces will maybe change, the materials will maybe change a little bit, the design will change. From an aesthetic point of view, from a prosthetic point of view, I think we are maybe going to even more aesthetic materials with better light transmission and maybe stronger aesthetic materials. Well, I have had the pleasure to teach for the gIDE Institute, and I think if I would look at the lectures that I would maybe appreciate really the clinical tips. It's all about clinicians giving you the tips that will make the difference, I think, in daily practice.